I've never been prouder to be associated with the NHS or its staff. I've witnessed tremendous, compassionate, skillful, effective care given in the most challenging of circumstances. It makes me a little bit emotional. Really grateful to the staff, but extra grateful to the volunteers who've given tens of thousands of happy, smiling, cheerful hours to our programme. Really, really helped us out. Couldn't have done it without them. Thank you.
Because with COVID, we couldn't visit my dad in hospital either, and that was a worry, that I wouldn't be there to look after him, that he'd be there on his own.
I was treated straight away. They were excellent with me. I was taken through to a treatment room where they took blood, get my temperature, and then they put me on the drips and the antibiotics, and I was there for quite a while. And then eventually they took me out of there and they put me in a corridor. Actually, when I left the house, I didn't have anything with me. I didn't have a phone, money, a watch, nothing. The only thing I had was my hearing aids.
Yeah.
Yeah.
I was so hopeful that he wouldn't go to hospital that we didn't pack a bag.
We didn't pack a bag. Yeah. I was led on the trolley in the corridor for a long, long time. And the paramedics that had actually fetched me into the hospital walked past. And for some reason, they recognised me. And they said to me, "Are you still here, Paul?" And I said, "Well, yeah, I am actually." And he said, "Good heavens." And they said, "Is there anything we can do for you?"
As I was walking down the corridor, I saw Paul on a trolley against the wall on oxygen. So we gave him a glass of water and then we left. And then on the next patient, we went back to him. And I think at every patient we went into hospital, we kept going to check on him because he hadn't moved from that corridor at all. He said that he'd not spoken to any of his family because his batteries in his hearing aid had gone. So then we went hunting for batteries. Yeah. You won't believe how hard it is to find batteries. So we went looking for batteries, and after that we got him some waters, so he didn't feel like he was bothering anybody by asking a member of staff if he could have a glass of water. So we got him a pack of waters, and so got some flavoured water as well. Yeah. And then he was adamant he didn't want anything to eat, but we got him some chocolates, meltable chocolates, so he wouldn't choke on it.
Later on in the evening, they actually came back again. Right, and they fetched a case of water, and they fetched a big bottle of flavoured water, and they fetched some chocolate and refreshments, so I wouldn't have to bother anybody.
And it was so lovely to hear that two people, these paramedics that brought him in, went and checked on him, and brought him things, and I think they even noticed that you had a problem with your oxygen cylinder as well.
Yes, they did.
And so they were giving him care as well, and for them to actively go to him and see if he needed anything rather than him having to ask, I thought was just so lovely. I've never heard of anyone being that kind.
I've never seen somebody be so grateful for something that I class as someone just attending somebody's needs, just the little things in life. And it was nearly in tears, which really brought us to tears, wasn't it, the way he was.
To see Paul and Katie again today, it's nice, it was emotional. But like Newton said, he's back with his family, and more importantly, he's in good health.
Everyone's got their own story of what's happened over the past couple of years with COVID-19. And it might be an emotive one, it might seem like a simple, straightforward one. But there's countless stories out there and examples of people going above and beyond to help our population and patients get through this. So whether we look at one or hundreds, we need to make sure that we're saying thank you to those staff, volunteers, and everyone else that was involved. So thank you.